Welcome to AACE Podcasts. Thanks for tuning in as we elevate clinical endocrinology by taking deep dives into trends and topics that can help us improve our patient care and global health. Find the latest episodes on aace.com/podcasts. And now, let's meet the endocrine experts who will be talking with us today.
Hi, and welcome to another episode of the AACE Podcast. I'm Dr. Cheryl Rosenfeld, a practicing endocrinologist in Parsippany, New Jersey. I also serve as an adjunct clinical associate professor of medicine at the Touro College of Osteopathic Medicine in New York and endocrinology subspecialty education coordinator for the internal medicine residency program at St. Mary's General Hospital in St. Clair's Health, New Jersey. I've had the privilege of working with many patients over the years, helping them navigate their thyroid conditions and achieve their wellness goals. Today's episode is truly special because I have the pleasure of being joined by one of my patients who will share her personal experience with thyroid disease. She'll also talk about how AACE's journey for patients with thyroid disease has been a valuable resource in her journey. Welcome, Andre, and I will have you introduce yourself.
Hi, I'm Andre Campbell, and as Dr. Rosenfeld said, I'm one of her patients, longtime patient.
All right, well, it's so wonderful to have you here with me, Andre. And before we dive in, I'd just like to extend our gratitude to our sponsors, AbbVie and Amgen Rare Disease, for supporting this important and engaging discussion. For those who may not be familiar, the AACE Journey for Patients with Thyroid Disease is a patient-centered resource that translates the complexities of thyroid diseases into easy-to-understand information. It serves as a roadmap to help patients navigate their conditions, their treatment plans, and their wellness goals with confidence. So, Andre, to start, can you tell us a little bit about yourself and your journey with thyroid disease?
Okay, I underwent surgery before my 4-month endocrinology checkup for diabetes, and during the checkup, blood tests revealed irregular thyroid levels. Believing the surgery might have caused the imbalance, my doctor decided to wait 6 weeks before retesting. However, the follow-up blood test showed no changes. My doctor then ordered a radioactive iodine uptake test, which showed that I had hyperthyroidism. I was prescribed methimazole to manage the symptoms. Later on, thyroid nodules were discovered, biopsied, and unfortunately, everything turned out well.
I do recall that it took a while to get everything straightened out and make sure that that you're doing well. And I'm very glad to hear that everything is going well. So, how did you first come across the AACE Journey for Patients with Thyroid Disease website?
You had suggested it to me, and I went in and I looked at it, and it was very informative.
Yeah, I do tell a lot of my patients because as you know, we don't always have a whole lot of time at the office visit. And certainly when you get home, questions pop up that you may not have thought about during the course of your visit. So I think that there's a lot of education there. And in addition to that, there's a really important part of the website that says questions you can ask your doctor. So things you may not have thought about that you can, go home, read about, and then ask me later. So I think that there's a variety of things on the website that are really helpful for my patients.
Yeah.
Did you find that the website helped you better understand your thyroid condition and the available treatment options?
Yes, I felt that it increased my awareness. I was so unaware of the symptoms and risks associated with thyroid issues, and this knowledge can lead to earlier diagnosis. So it also highlighted the nodules that I had, which I, again, had no idea about. It included information on nodules that helped me recognize additional signs of thyroid dysfunction that may otherwise had gone unnoticed.
Yeah, there's a lot of thyroid symptoms that seem like other things. So it's very easy to kind of pass them off as other things that you might be experiencing. So we outlined some helpful steps. So how did you feel that those steps helped you to, when you come into the office for your next visit?
Well, I think it empowered me more by outlining diagnostic steps and treatment options. I was better equipped to seek timely medical care and understanding the potential complications, which emphasize the importance of addressing thyroid issues promptly. It offered a clear plan. The step-by-step approach guided me in managing concerns effectively and supports informed discussions with my doctor.
That's really very helpful. Were there any specific sections or resources that you found most helpful or particularly helpful? So did you use any of the downloadable infographics or the educational video, and how useful were those?
They were very useful. The website and videos served as an excellent resource for gaining a deeper understanding of thyroid-related issues, including the hyperthyroidism and thyroid nodules. Sharing this information, enhanced knowledge, equipped me with essential facts about the symptoms, risks, and treatment options. It encouraged timely medical consultations and regular monitoring of thyroid health. And it helps you take control of your health by understanding your medical condition and available treatments. I would consider recommending this resource to friends and family who may benefit from its insights.
You would hope that folks have access to this even before a diagnosis is made, so that they can go in when they feel like they have symptoms of thyroid disease, and look up some of these things and be able to present some important questions to their doctors. So I think that's very important to really take control of your health, your symptoms, and the potential for the adverse effects from thyroid disease. Finally, do you have any advice or recommendations for others who might be going through a similar situation?
Yeah, I would say, undiagnosed hyperthyroidism for me can significantly impact your quality of life and lead to severe health complication. The awareness and timely diagnosis are key to managing this condition effectively, and seeking medical attention is a vital step toward improved health.
Well, I'm certainly glad that you sought medical attention and that you came to me looking for that attention. And Andre, thank you again for joining me today and sharing your story. Your insights are not only inspiring, but will undoubtedly resonate with so many others navigating their thyroid journeys. So, to learn more about the ACE journey for patients with thyroid disease, visit ace.com/thyroid journey. Thank you.
Thank you.
Thanks for listening to another great ACE podcast. Join us for another episode at aace.com/podcasts and help us in our mission to elevate clinical endocrinology. Together, we are ACE.